Okay, hello, my name is Emily Fairfield and I'm a St. Martin's nursing student and I'm going to be demonstrating how to insert peripheral IV as well as an IV push today for Mr. Scott. And so first I want to go to my MAR and double check that I have the correct drug and the correct orders for this patient, as well as double checking their allergens, and to double check that I have the correct drug, as well as double check my drug, make sure it's the correct drug that they need. The morphine is what I'm going to be giving, and this drug is here. So right here I have 10 milligrams of morphine per 1 ml, and the order is for 3 milligrams, so I'm going to be giving 0.3. This is an IV solution and we're going to be giving it through IV. He is in pain, 6 out of 10, so this is for the right reason, the right route, the right patient, and the right time, because he hasn't had it in a while, so we're good on that account. I'm also going to double check that this does not need to be diluted and that it does not need, I'm going to double check the safe dosage ranges. So then I'm going to come to my patient's room, knock knock, I'm going to give privacy, and I'm going to, hey nurse, can I get that sanitizer? I don't have any sanitizer in my room.
Of course.
Thank you so very much.
Welcome.
Sanitize in my room. Hello, Scott. Can I get your full name and date of birth, please?
Scott Mingus, 1998, March 9th.
Okay, thank you. I'm just going to double check your little badge there.
Okay.
Scott Mingus, perfect. Okay, well, Scott, your doctor today has ordered you a peripheral IV as well as morphine injection into that for your pain. Just double checking, you still have pain, 6 out of 10?
Yes.
Okay. Well, have you ever had an IV insertion before or blood draw?
Yes, but is there a kind of explanation?
Oh, sure. So what's going to happen is I got this catheter right here, and this has a little needle. It's going to insert into your vein, and that needle's going to go away. And what's going to stay is that little catheter that I'm going to hook up to some tubing, and that's what we're going to inject the fluids into. And the procedure shouldn't hurt after that. It will be a pinch and a burn right at the beginning, but after that it shouldn't hurt at all. Just to double check, do you have any allergies to iodine or latex?
No.
Okay, good. So next I'm going to go over some of the side effects of this drug. Have you ever had morphine? It's an opioid pain analgesic.
Mm-hmm.
You have?
Yes.
Okay, well, I'm just going to go over the pain, some of the side effects that could happen with this, just in case you might have not heard some of the side effects. So this is going to be for your pain. Some of the side effects can be nausea, you can get dizzy, you can feel very sleepy, and that's normal. You can take a nap, that's completely fine. We will be checking on you quite often, because another side effect could be that you could get respiratory depression, but we'll be watching very carefully and checking on you. You should know that it can cause some constipation, so it will be good for you to increase your fluid intake.
Mm-hmm.
So that's just some things to think about. Are you still good with this, going ahead with this?
No problem.
Okay, well, I'm going to get you at a comfortable height for me. So I'd sit him all the way up. Get your arm up to an area where I can reach it, and then I'd look for a good spot on your arm. Make sure there's no counterindications, no AV fistulas or anything, and then I time lapse over to my table over here. Okay, so now I've got my arm here. Oh, it's dripping. Okay, so I got my table over here. I'm just feeling Okay. Looks like your arm is all ready to go. Okay, so Scott, I'm just going to get this tourniquet on you really tight. Okay, Scott. I feel like I should have this here. You can see everything really good? Okay. Okay. So I'm feeling, I feel that. Can you open your hand up and down, up close?
Yeah.
Okay, good. I still feel your pulse.
Mm.
Okay, that's a good spot. Okay, gonna let that go there. And I'm going to scrub real hard there. Okay, so we're good there. Whoop. Okay, and now I'm gonna let you dry there, Scott. So we're gonna get set on setting up the rest of my stuff here. So I got the saline here. So I'm going to scrub this. Okay. And now that I'm going to do that, I would loosen the cap on here, and then I would pump this, get rid of the bubbles. Pretending there's still a cap on there. Okay, how you feeling there, Scott?
No worries.
Okay. Well, next. Okay, are you ready?
Yeah.
Okay, well, one more sec. I'm going to get this ready here. And what I'm going to put here, that does not take any kind of writing very well. It's my gauge, which is 20, and the date and the time.
Mm-hmm.
It is 16, and it is. So now that is all set. Okay, now we're gonna get going. As tight as I possibly can here. Okay. I'm gonna hold underhand here. There we go. Now I'm going to insert or increase the hub. all the way up. And I'm going to compress that. Release that. Releasing the cap on this. Okay. Now to get this sticker on you, while holding it steady with my hand. Okay. Next, I'm going to take this and I'm going to aspirate, and I see some blood flow back, and now I'm going to push back about 3 mLs really slowly. And I can let that set while I get my drug ready. So right here, I'm gonna set this, get this all set up. Cleaning the top here, I have morphine sulfate, 10 milligrams per ml. I'm going to be drawing up 0.3 mLs for 3 milligrams for Miss Scott Mingying. For his pain, 6 out of 10 for the right reason. He hasn't had it in a while, so he's the right time. This is the right way. It's IV solution, so we're good there. Okay. And now I'm going to scrub the hub. Okay, and while I let that to dry, I'm going to do my final check. So I have 0.3 milliliters to equal 3 milligrams of morphine sulfate for Miss Scott Mignon. For the right route, which is IV solution for his pain, 6 out of 10. And the time, he hasn't had it in a long time, so he's due for it. Okay. Okay, and my gloves were clean when I inserted my IV, so I didn't change them at that point. My IV. Can you pause it? Okay, so I asked for help to go get my alcohol wipe. And then I will insert 5 mLs at the same speed as my drug here. Then I secure that there, and I can clean all up. Okay, Scott, you're all good. I can get you at a safe position now. Back to your safe position. Your call light is near your bed. If you have any problems, let us know. I'm gonna give you some pointers on your IV here. If you feel any pain or redness, just let us know, as well as if you have any paleness here and swelling. Another thing to let us know about, that means your IV is not going where it's supposed to go. Try to keep this from catching on things. Don't go taking it out on your own. Don't go smacking it on things. And I will go chart how you did. How was that after all? Was there any like major pain? Still feel good?
Perfect.
Okay, well I'm gonna go chart, you know, what your gauge was that I put in, that there is, you know, no infiltration. I got aspiration back, how much I put in the eyes and nose, how much drug I administered, how you tolerated that, and all the teaching that I did, as well as that you did very well.
Thank you.
Okay. Have a good day. Yeah, you're good.